So, hi, I'm Allison. I am a senior in college. I am studying psychology with a minor in education. Just a little bit about myself. I am the first one in my family to attend college. I'm from Eastern North Carolina, and I'm interested in mental health education and research. So, today I'm really, really excited to be talking to Solome Tibebu. Solome is a behavioral health strategist who works with numerous health companies that are transforming mental health access and equity. So, as an anxious, you know, college student going into my senior year, I'm just really excited to talk to you and learn more about your journey, how you took your education and you applied it to mental health work. So when I was reading about you, Salome, I read that as an anxious teen, you founded and ran the nonprofit anxietyandteens.org for 10 years. So could you tell me more about that experience?
Yes, and thank you so much, Allison, for inviting me. I'm so excited to talk with you and lots of good discussion pieces here that we'll cover in the time we have. Um, so yes, let's see. I had really bad anxiety, OCD, obsessive compulsive disorder, as an adolescent, and continued struggling with that as a high school student. And it was around that time where I was the type of teen that would go to the local bookstore and read as much as I possibly could about OCD, for example, to just understand what was going on. And for me, that, as cliche as it sounds, knowledge really is power. That psychoeducation was so helpful for me. And my mindset was, why can't all teens everywhere be able to access this kind of information quickly? But also, uh, equally important is, how could I know that I wasn't the only teen going through this experience? And so that's when, in 2006, when I was 16, I got the idea to start the Anxiety and Teens website, which very creatively named. I still to this day am not very good at naming things. Um, but as you can imagine, the topic was about anxiety in teens and connecting with peers so that they could hear firsthand stories from one another. And at the time, we had evolved from one janky iteration of the website into the next, and we used forums. But now, so many years later, it's just a completely new world when it comes to so many more advanced, better user experience digital platforms. So I'm excited about the innovation that's happening now for youth mental health and how it could help the needs of teens so much better.
Right. Yeah, that's awesome. I mean, as a 16-year-old, that seems like, such an achievement. That's really impressive. And I hear you in saying that just being able to talk to someone or know relate to someone and share that experience or share anxiety, OCD, whatever it is, can be comforting. And as a peer mental health coach at my college, I think having that relationship with another peer, knowing that you're talking to someone your age who's going through the same thing can be really helpful, even if, they can't give you advice per se, but being able to just vent to someone. But it sounds like you really had to take, lessons in maybe creating a website and these other skills too to just create anxietyandteens.org. And so could you talk more about how you used education and maybe business and entrepreneurship in the mental health field, and like what led to that connection between entrepreneurship and behavioral health tech? Yeah.
Yeah, absolutely. So for me, I attended the University of St. Thomas in St. Paul, Minnesota, and I decided I wanted to become an entrepreneurship major, which was definitely not a field my parents were familiar or excited about in terms of my major, being immigrant parents that they were. But I knew that that was what I wanted to pursue because I already got a taste of what entrepreneurship and this new world of the internet and mental health could be through my experience building that Anxiety in Teens website. And I'm grateful that St. Thomas had provided a curriculum that could allow me to learn a little bit of accounting and finance and marketing. But in addition to that, they did a great job of providing a lot of extracurricular resources. For example, they had a university associated fund that was investing in student and alumni innovations. And so I also received an investment for an online CBT concept that I built. They did a great job of helping to support students network with real business people and entrepreneurs off campus, which I think is really important for any of the other students that are listening. That's a really great opportunity to just dip your toe into any career field that you might want to learn more about. And a lot of folks are happy and excited to help people, especially if you're looking for expanding into the field of mental health, which is very exciting.
Yeah, sometimes my dad loves to say that networking is so important. And, sometimes it's like what you learn outside of just the classroom and the connections and, opportunities that you might have available that could really shape your career and what you do after school. And yes, I'm going through the process of trying to decide what my next steps are. But I think that college is a great place to explore, like you said, and dip your toes into different fields. And I'm curious if, on top of the other, networking opportunities you mentioned, like internships, that sort of thing, did you feel, if you would like to talk about maybe what your college did to support mental health on campus, and like how or should college campuses even be responsible for providing mental health care for all their students?
Yes. We had a student counseling center and even had a visiting psychiatrist, but candidly, I think since that time, so much has changed, as we mentioned, when it comes to digital and virtual care, uh, better understanding of how peer support can be so meaningful. I think there's actually a lot more that could take place on campus, and I think it's an excellent place for mental health to be available, because the data shows a lot of conditions. This is the time period where those diagnoses are happening. Maybe symptoms have been persistent for a young person for years, and they're only now, and while they're in college, experiencing them more severely, or they're getting that diagnosis, and it's a stressful time. So, where else but at college to be able to connect with resources, whether that's clinical or peers. I mean, it's such a huge period of transition that I think it's really critical.
Yeah, sure. I hear you. And as someone who started college fall of 2020, it was a ginormous transition, but luckily, there are resources at college that I'm very thankful for, that they're able to, you know, support me. And I think that I agree with you that college, like you said, is a stressful time. And I think having those supports there is definitely something that colleges should be working towards. But, and you mentioned, innovation in the field and what that looks like. And it reminded me of my psychotherapy course that I took last semester. And we mentioned how sometimes college campuses could feel a burden and not be able to provide adequate quality care for all their students, and what could other supports look like, how could AI even impact mental health care. And I would love to hear your thoughts on that, Solome, about how AI is transforming the behavioral health tech world.
Oh, well, you hit on something so important, which is we definitely do not have the provider network, the workforce available to meet the demand anytime soon. Unfortunately, this is even more so for young people. And so Yes, I don't think that digital mental health is just a nice to have. I actually think it's quite vital that we lean into these more scalable tools and solutions to be able to support adolescents, college students, and just more broadly, everyone. And so, yeah, I mean, impacting every field dramatically. But even in mental health, there are some exciting and interesting applications. Everything from being able to detect through voice or chat if there are any risk factors that could alert a clinician of if a college student is struggling, to being able to evaluate if providers or even coaches or peers are delivering evidence-based uh, care to the patient or client they're seeing. And so, yeah, I think that there's a lot of opportunity to leverage tech and specifically AI to extend the reach of our limited providers today, or at least ease the burden and the pressures that they have to try to support this really immense demand for services right now.
Yeah. Yeah. I think I agree with what you said that AI is, you hear it a lot. You hear talk about AI a lot now. And um I really like appreciate your take on it, that it could definitely be used for good and have some positive effects on mental health, and hopefully make it easier for everyone to access. Yeah, thank you, Salome. And I'm just wondering, is there anything else you think we should know as college students, maybe about to graduate, about to choose a career, that are maybe interested in psychology?
Yes, thank you so much. And I just want to point out that really, for those watching, Allison is the future. This is very exciting. Thank you for exploring this career path because, as you can see, there is just so much demand, and your ability to make an impact is so immense. And I feel that that's even going to be more so the case as somebody who is going to be a clinician who is digitally savvy. I mean, just think about how many more patients that you'll be able to impact. And so I want to thank you for uh, exploring this field and taking the leap. And then finally, for those in the audience, on that note of taking the leap, now is the time to explore and take risks. And so even coming to conversations like this to be able to learn, just dip your toe in the space, I think that's just a really great step. And whether that be mental health or any other field for that matter.
Thank you so much, Solome, for your time and talking to me today. It was so nice to connect with you. And yeah, I'm really happy that, I'm really grateful for your time tonight.
Likewise, thanks so much for doing this. Thanks for having me.
Yeah.